So thank you so much, everybody, for joining in. If you don't already know me, my name is Meghna Dassani. I am a general dentist. I practice in Houston, have had my practice for 15 years now, 14 of which I have integrated and implemented sleep in some way, shape, or form into the practice. And if you don't know my story, there's a very personal reason as to why I got into Airway. And I'll spare you the long details, but the bottom line is to help people in my family, people that I love. And what I realized is that the family that I considered mine, that I wanted to help, wasn't just with my immediate family, right? It turned into my office manager's dad, our UPS guy, our favorite patient's father-in-law, whatever that may look like. And it quickly made me realize that there are more people that need our help than not. And sure, I could be the only dentist doing this, and I can help what, 1,000 people, 5,000 people? How many am I going to be able to impact by being an N of one? But what I realized is that each of you, each of us, has so many patients within our practices that need our help, that are looking for help. And then add to it the fact that we had the ADA recommendations that came out in 2017. Can you believe it? It's going to be 2027 next year. So for 10 years, we have been talking about how we should be screening our patients for sleep disordered breathing, for sleep apnea, and that we should be having these conversations. Now, all of that is not the goal of today's call for today's meeting. What I find when I talk to doctors, when I talk to team members, actually, we have hygienists and team members that are also either have registered or are part of, that have joined in today, is tell me if your office is one of these, because my office manager will sit here and tell you that. And if those of you that know her know she will not hesitate. We all go to these CE meetings, right? There's so many amazing speakers on so many amazing topics. And we spend all this money, we take time away from the practice, from our families, from, whatever it is that our children are in, and we go to a CE class. And we get there and we're so excited. We're like, oh my gosh. And this used to be me, right? I'd be like texting my office manager, my dental assistant in a group chat. We're going to order this, this, and this, and we're going to do this, and we're going to create these systems that are going to treat so many patients, and let's set a goal. And if we do this, I'm taking everybody to New York City, right? We've all been there. We've all done that. And then what happens? We come back to the office on Monday and life goes on, right? We still have the emergency patients. We still have a team member that calls in sick, or our child that needs to be taken to the pediatrician, whatever that may look like. And then everything fizzles out. And that I find is the biggest stumbling block that I have found doctors and teams, not just doctors, teams as well, struggle with in, oh my gosh, Meghna, teach me how you integrate and implement this into your practice. I'm a general dentist. I have done everything that the rest of you do, right? I've trained with all of the big names in dentistry. I have trained to place implants. I do aligners. I do frenectomies, crown and bridge, full mouth rehabs, whatever it is that you do, I do as well. So, what is the magic, the secret sauce that has helped me integrate and implement this? And no, I do not have an associate. I'm a solo practitioner. I work 3.5 days a week. The other days I still teach. My husband jokes I have two full-time jobs just because I love teaching and educating um, other offices and how to integrate and implement all of this into their practices. And I go down rabbit holes and I forget why I told you this. But the point is, that is the biggest stumbling block. How do I integrate and implement this? And which is why we're here. I'm going to switch to my slides because I could talk to you guys about Airway for the rest of the evening and we will still not get anywhere. Here we go. If somebody could just Let me know in the chat that you can see this. If Andres, would you give me a thumbs up if you can see my slides? Very good. Awesome. So the point I am here to make today is that when you are integrating Airway into your practice, I want you to remember that it is not a procedure. It is a system. And I have always said this, and I will make this point multiple times today as well. Airway is a team-driven procedure. That is the easiest way for us to integrate and implement it. So in my practice, when my Airway coordinator, who also happens to be my office manager, who also happens to do my medical billing, so no, you don't need three extra team members. While she is doing what she's doing with my patients, I am in another op. If she's in op five, I'm in two or three, prepping a crown, doing a filling, seating a crown, seeing a new patient, post ops, or even doing hygiene checks. I have two hygienists, two assistants, and two in the front, and that's who helps me run a general practice. And the reason we're able to do this is systems. You need systems, protocols, and a team that is going to support you. Because maybe you're some of the doctors that say, or team members that say, I've heard a few CE on Airway. I really haven't gotten fully trained. Or there may be some here that say, I'm trained, but I really don't. I haven't been able to integrate this. I haven't been able to implement it. What can I do? How can I do this? I just don't know why I get lost. You have the clinical knowledge. You're doctors. A lot of times, most of the times, what we lack is the systems that can sustain this. Do you have the systems that are going to take you and your team from where you are now to where you want to be and where you need to be? And you could be the office that says, I don't care, Meghna. I don't want to be an airway specialist. All I want to do is a couple of cases a year. Sure, but are you really going to be able to do that? Are you in good faith? If you're here, know that you have the knowledge, you're screening patients, you're seeing the signs, and never do anything. Or are you going to be the doctor that says, every patient that comes through my door is going to be screened? The conversation is going to be had, and I know I can't be the only one doing it, which is where your team comes in, which is where the systems come in. Why does it feel so hard? Because you think it's your job, it's as a one sole person doing it that gets to and has to do everything. No, it's because it's not part of the systems. It is not ingrained and built into the everyday dentistry that you do. Do you really have to be the only one that talks about why a patient needs a crown? I'm sure your assistant can talk about it. I know your hygienist talks about it. For sure, your front desk is able to answer questions, right? If I were to call and say, ask. And that's exactly what Airway needs to be. It needs to be woven into the structure of what your practice stands for, who you are as a doctor or as a team member. And the problem isn't more education, although I can sit here and give you all the education. You probably have the education. You know why this needs to happen, and you know what needs to happen. What is this gap? It is the how. How can I integrate this seamlessly into my practice? How can it be implemented so that every team member, every person, every system, everything that we do flows into it? And there is continuity. Do you have a system for when, if I were a new patient and I came in with a cracked tooth, maybe I've broken off the distal lingual cusp on number 19. Is there a system in place in your practice as to what that would look like from start to finish? It may not be written down, but it is going to flow smoothly, isn't it? You know what conversation the hygienist is going to have or the assistant is going to have. You know the explanation you're going to give to me, what finances is going to look like, and how the handoff is going to look. That is a system. And what happens when you don't have a system? Your patients fall through the cracks, right? If there is no handoff between the assistant and the front desk, well, maybe the patient never gets scheduled, or copays or deductibles are never discussed. If the team was never educated or trained on how to present a full mouth rehab or how to present a certain procedure that you do, they're never going to talk about it, right? A lot of doctors say, oh my gosh, I come home with the knowledge, but my team doesn't support me, or they just don't get it. Or my team thinks, oh my gosh, here's one more thing I now have to talk about, right? let I will give you my example. Forget, let's forget talking about anymore. So I am trained, fully trained in implants. I've taken Carl Misch's course when, Dr. Misch was doing it. I've taken Dr. Garg's. I've taken so many other courses. I've done all on force, everything there is to take. I must have spent $100,000 on that because at one point I thought I really, really loved implants and I wanted to do it. So I have the knowledge, I have the experience. I don't do it anymore. If you were to sit here and ask me a question about implants, about a placement or a restoration, even though I still do it, or a sinus lift or whatever, am I really going to sit here and give you that information? Or am I going to find a way around it and either guide our conversation to sleep or the US Open and what the latest Lululemon merch at the US Open looks like, right? We're headed to the US Open tomorrow, hence the example. And why is that? Why would I do that? Not because I don't want to share with you the answer to the question you may be asking me, but it's because I don't have the confidence or the knowledge to be able to adequately explain that to you. I know I'm going to feel stupid, and nobody likes to feel stupid. Not us, not our team members. So when you have a team member who we think is not on board, a hygienist, a front desk, an assistant, I can assure you it's because they don't feel confident enough. They don't think that they know enough to be able to articulate it with the patients. And or they don't know how doctor wants them to talk about it. Believe it or not, they are a lot of times worried that they're going to let you down, or worse, you're going to get mad or upset with them. How do I know this? Been there, done that. If there's any mistake to be made, I have done it. This is also when screening is inconsistent. This is also when conversations don't happen because I'm going to assume my hygienist is in here. She's not. At least I don't see her name. But we're going to assume Ashley's on this call, right? And Ashley's going, I know I heard this CE about what questions to ask the patient. But what if the patient asks me more follow-up questions? What if I don't know how to answer it? What if Dr. Dassani gets upset with me if I say the wrong thing? What if I tell the patient to mouth tape when they really shouldn't be mouth taping because we haven't established nasal breathing? Isn't it easier for Ashley to then say, I'm just going to skip just this one time? And then it becomes a habit because she lets it slide. And now screening is inconsistent across the board. If there is anything that happens, it's only because the doctor talks about it. And at some point, the doctor's not able to talk to every single patient about every single thing without running late in every room, is it not? And then follow-ups don't happen. Be it with insurance, be it appliance follow-ups. It could be an MD that's referring patients to you. It could be, I have a patient that finds me on Instagram and I say to Dr. Michelle or Dr. Sarah, and I say, oh my gosh, you are in whatever state. Let's assume I'm in Houston, you're in Florida. I don't know where Dr. Sarah is, but I'm going to assume that. And I call the office and refer a patient. Is that going to follow up? Or have we just lost a patient? So when you don't have a system, not just for training, but for follow-ups, for screenings, for educating your patients as well as your team, for tracking, that's when Airway becomes that one thing we were going to do, or worse, oh, we're going to get to it someday. And then you look back and it's like 3 years ago, you took that class at Yankee or the Greater Houston meeting or whatever that may be. So I beg you to stop trying to add Airway to your practice. I want you to make Airway interwoven into the very fabric of your practice. It is not something that we add. It should be as natural as talking about a crown or talking about periodontal disease or talking about aligners. We should be talking, we're talking to our patients, we're talking to our teams about how are we screening this? What is the diagnostics? When I say how you diagnose, let's have it very, very clear. As dentists, you and I are not allowed to diagnose obstructive sleep apnea. We can screen for it, we can talk about it, we can refer it for it, we can treat it, but it's our medical colleagues that have to give us the diagnosis. When you get the diagnosis back from your MD, what is that going to then look like? What are the conversations? Are you picking up the phone? Or is your team getting them in and having a conversation? How your team communicates to the patient, but also with each other. Is Ashley telling Diana, hey, this and this happened. Let's make sure he is scheduled for this next, without me having to get involved in the process? What does the patient flow within the practice look like? And I don't mean from the one room to the other, right? Because our patients are being seen for perio, they're getting their recalls done, they're getting seen for their restorative stuff. And now Airway has its own pathway. And sometimes a patient, like we had a patient today that needed to come in for their recare appointment, needed to come in to get a bridge done. And I was like, hey, let's make sure we have this follow-up scheduled as well. And that is, and they're like, yep, we got it. She has her appointments in December. November, she's coming back for this, and the next appointment for recare is in whatever that may be, February, let's assume. What is that workflow? What's the flow looking like? How is that for your patient? And how do you collaborate with medicine? I was going to say all of my referrals, but I would be lying. 95% of the sleep patients that I see within my practice are either patients that find me for Airway, although I'm a general dentist. Majority of those are referred to me by my MDs. The sleep MDs that I work with, the ENTs, cardiologists, neurologists, pediatricians, they are the ones that are referring those patients to me, not because I'm anybody great. It's because we have a system. There is a workflow, there is a way things are done. It's like if you were to if I were in your chair and you had to do a buccal pit composite, isn't there a certain path that you follow? You remove the decay, you're checking that there's nothing left behind, you etch, prime and bond, and fill, right? If you miss a step, things are probably not going to work the way they need to, which is why we need systems, protocols in place for our practices to be what I call an integrated airway practice. It's woven into the fabric of your practice. And these are the 5 pillars, as I call them, of having an integrated airway practice. And if anyone is lacking or missing things, or we're taking shortcuts through, that's when that implementation becomes hard. That's when we put our hands up and say, this is too hard. My team doesn't listen to me. And we've all been there. I have too. When we talk about the clinical aspect, operations, right? Team, super important, Airways team driven. Your referrals, whether you're referring to somebody, my sleep MD, or the cardiologist, or an orthodontist, or a myofunctional therapist is referring to me. And then the business. At the end of the day, we are in our practices. We take time away from our families. We take on all this debt and student loans and everything. At the end of the day, it is a business. You have to be profitable. You have to be productive. We all have payroll to make. We all have lives to live. We all have teams that depend on us, loans, insurance. I don't need to tell you what running a business costs. So at the end of the day, we still want to make sure we're profitable and productive. And it has to be tracked. You have to know what it is that you're doing, and is it even worth your time and energy? So when we get into our clinical systems, if you haven't already, please get into your workbooks. I know it was sent along with the Zoom link when we sent the email. If not, it is in our chat box. You should be able to access it there. The very first thing that we look at is our clinical systems. Is your practice identifying the right patient consistently by screening? Are we looking at the signs and symptoms? Are we asking the questions? Does our medical history reflect that? Are we having the conversations? Are we just tooth doctors? Are we just gum doctors? Because we all screen for oral cancer and for perio and for restorative. Or are we looking at everything beyond it? Are we asking the questions? What is our diagnostics looking like? Are we referring for sleep studies? Are you in a state where you're able to dispense home sleep tests? What are those identifying factors looking like within the practice? What does treatment planning look like? The doctors that go through our cohorts, I always tell them, once you get into Airway, once you learn what to look for and what conversations to have, the first thing that's going to change is your treatment planning. How you treatment plan cases is going to be completely different. And I know nobody here is a single tooth doctor. We don't look for one thing to fix at every appointment, but you start to look at things more comprehensively. Have you staged treatment changes? What are your follow-ups? Do we have systems in place when we have a patient that needs 3 different appointments at the same time? Are we measuring outcomes? Is it success? What does success look like? Is it an AHI of 5? Is that what I'm looking for? Or am I looking for subjective symptoms? Am I looking for oxygen? What is oxygenation looking like in that patient? Or maybe it's a combination of everything. So, as an example, today I had a patient who 2 years ago for a consultation, he was referred to me by the ENT who sends us patients, and we send him patients. And long story short, did not start treatment until today was a 6-month follow-up. So late last year, no, early this year, right? And we made him the appliance. He's had his follow-ups. I see patients for follow-ups at 2 weeks, 1 month, 3 months, and this was a 6-month appointment. He'd had a sleep study, went back to the ENT, had a sleep study, came back. His numbers weren't all that better. I'll be honest with you. He still needs to titrate the appliance. But the man walks in with a swagger like I've never seen before. And is very nice, very personable, asks me about my daughters. Both girls went off to college this past weekend. We are officially empty nesters. So everybody, all of my patients have been like very concerned. How are you holding up? Are you doing okay? Have you been crying? That kind of stuff. And he is just full of life. And I go, how is your appliance working for you? I have the sleep study back here from the ENT. He's like, you are the best thing that has happened to me ever. Other than my wife, you are the best thing. And I was like, ooh, tell me more. I want to hear about this, right? Who doesn't want to feel good about themselves? And he's like, I've been seeing, Dr. ENT for so long. I've had sinus surgery. I've done this, I've done that. I said, I know, but I'm not very happy with your numbers. Like there's still room for improvement. We got to titrate some more, go home and change the straps out. He had a Panthera. And he's like, you know what? You can say what you want. I will make the changes you need, but I will tell anybody that listens to me, this is by far the best thing I have done for my health. And I'm like, okay, I'm going home. My day cannot get better. It really just can't. And all of this because 2 years, he could have fallen through the cracks. He could have been one who's like, oh, well, I guess he wasn't interested. we're going to keep talking, or all our patients are like that. Nobody listens. Nobody wants to do treatment. Because you have systems in place, because I know he needed a follow-up that was scheduled, came in today, he left with his next appointment, and I have outcome measurements. Am I still going to touch base with the ENT tomorrow? Absolutely. There will be a text message go through. Hey, can you make sure allergies are being addressed? Because even though we are where we are, numbers aren't where I want it to be. And patient says it's because he can't breathe through his nose. Not all failures are on me and you, right? As dentists, we measure our worth in microns, millimeters, open margins. Oh my God, I lose sleep over those. But here, when I have a system that consistently tells me what needs to happen next, I don't worry about it so much, because if I weren't in the office tomorrow, which I'm going to the US Open tomorrow, does my team still know who to screen? Is my hygienist going to be having the conversations? Absolutely. Do they know what to look for? Yes, they're going to talk about bruxism and scallop tongue and whatever else it is that they're seeing. If we're seeing a child mouth breathing, we're going to look for the signs and symptoms. What records to take? Are they going to set me up for success for when I go back into the office on Monday? Is this something that needs doctor to look at it? What needs to happen? What needs to happen next? If this answer is no, if your team does not have a yes or to any of these questions, we don't have a system yet. It's not too late, right? We all started. There's always day one. It's like I tell my patients, we got to hit the reset button. You missed your cleaning for the last 2 years. Today's a new day. We got to hit the reset button. And that's where this is. We don't have a system yet. Then we get into operational systems. What happens after I've done the screening? What does scheduling look like? Do they know where it goes into my schedule? I use block scheduling. I'm sure a lot of you guys do as well. My sleep coordinator has her own column. I run hygiene columns as well as mine. I'm a single doctor in an 8 operatory practice, and we use every single op. And the only way this happens without me feeling like I'm a chicken with its head cut off, some days that happens, but it's not because of all the columns. I try to do too much for too many people. What does that scheduling look like? What is the appointment flow? Do I need to be there for the entire hour-long consult or having that conversation in hygiene? What am I documenting? What do my chart notes look like? Do I need soap notes? Do I have a system for that? We built to medical within our practice. We have done it by ourselves for the last 14 years. We've tried many different companies. We figured out that keeping it in-house was the best way for us. And those are systems we teach the doctors that go through our cohorts. What documents are needed for that medical billing? Does she need a medical insurance card, or do we need something from the MD that we're working with, or are we filing for gap? What is going on? Those financial conversations. Hey, you have a deductible. Or if the patient doesn't have insurance or whatever that may look like, what is the cost? Do we offer financing? Does dental cover it? No, it doesn't, by the way. Those are at least for adult patients. Those are all conversations that need to happen. And then follow-ups to those. I now have insurance. Can you help me? Oh, I just lost insurance. What needs to happen? I have COVID. Texas has a lot of COVID right now. I need to miss my next appointment. How is that going to impact our follow-ups? Because a diagnosis, I could have a diagnosis from my MD, but if I don't have a workflow, if I don't know what's next, it's a dead end. You might as well open the back door and tell the patient, please leave and never find your way back, and it's okay. We'll survive. This is what we use and create, well, we created and use within my practice. And this is what I, teach the doctors that go through our cohorts as well. You want to screen, you're evaluating, you're having conversations, send it out for a diagnosis, have your MDs diagnose, comes back to you. We're presenting treatment, we're treating the patient, we're following following up, and we're measuring success or lack thereof. We're dealing with human beings. Sometimes we don't get the results we want for them and for our treatment. And we have to figure out how to measure that, how to circumvent it, how to help our patients feel better. It's not a failure. It's just, how are we going to reroute? And every arrow in this map is a place where your patient can fall off the track. They can get lost. But when you have a system in place, when we started, we literally had checklists for every patient, got a folder, and every step was checked off until it becomes second nature. Just like when you're cooking, right? You know when you want to put the salt or the spices, or when you're going to flip it over, or when does it get pulled out of the oven, whatever that may look like. And then your team. You cannot build an Airway practice by yourself. I mean, I said this maybe 3 times since we started. Airway is team driven. I cannot build this webinar by myself. I have a team member, Andres is here, and he's helped me put this together. We need a team if we want to succeed. What is it they say? If you want to do whatever, do it alone. And if you want to go whatever far, do it with a team. I'm sure you all have heard what I'm saying. But you cannot do this by yourself. What to see, what to do, when to do it, who owns the next step, who's going to do the follow-up. I mean, you could, but wouldn't your time be better used someplace else? And the only way your team is going to be able to succeed at this is A, yes, you got to train them, but B, you got to give them the systems. I cannot just tell Andres and say, yeah, let's do that thing that we talked about 6 months ago and give him 2 sentences on it. There has to be clarity. Yes, you're still the leader, the visionary. You're the guiding force of the practice, but if your team's going to support you, you got to give them the systems to build what it is that you're envisioning building. These are the questions that I get asked when we have doctors come through our cohorts. Doctors like, oh my gosh, I need more patients. Why aren't we finding more patients? Where can I get more patients? And you know what they want to do? They want to spend money. Should we do Facebook ads? No, you have 800 patients in your practice. Talk to each of those people. And then the hygienist is like, I really don't know what they want me to do. Like Ashley would be like, Doc, what do you want me to look at? I don't know what to say. And then the front desk is like, somebody calls, I don't know, they just come in, they'll talk to you. I don't know how to explain the appointment. And then the poor assistant is clueless. Wait, what are we doing? Nobody told me this. And when there is no dedicated roles, there is no dedicated system, what next, how to do it, why we're doing it, there's just, you could beat your head against a wall and it's never going to happen, is it? This slide it has so much more weight than I can even put in words. Airway care does not happen in a silo. That was one of the biggest ahas for me when I got into Airway. Working with physicians, with my ENTs, pediatricians, true story. When I started to screen children, the first doctor, the group of doctors that I went to was my own pediatrician, right? 2 young girls. And I went with two of my office manager and another front desk who was my pediatric sleep coordinator at that time. And we took them lunch. It's a group practice, 6 doctors, and we talked to all of them. At the end of that presentation, my own pediatrician, the doctor that my girls saw primarily, said, why don't you just stick to cleaning teeth? And I was speechless. I'll be honest with you. I didn't know what to. Now I have smart ass comebacks. But at that point, I'm like, okay. And needless to say, on the way out, I transferred records. I was like, can I please get a copy of everything? We're not coming back here. So fond of saying, we all have to find our frogs to kiss before we can find the prince or the princess. But sleep MDs, myofunctional therapists. Some of us are fortunate, not me, I say us, some of y'all may be fortunate enough to have a team member that may want to be trained in myofunctional therapy or already is. But we have such amazing providers around us. Orthodontists, yes, I have orthodontists refer to me all the time, and I refer out to them. This is not just them referring to me. This is a two-way street. Sometimes you are the quarterback. You sit back and you say, go there, do this, do there, talk to this doctor, and then I will come in. I will tell you where to go. Majority of the time, you're able to help them. But you actually get to dictate treatment. Or as my 5-year-old patient told me, Dr. Dassani is the boss of all the other doctors, of all her other doctors, because I'd be like, go see your chiropractor, go see the ENT, go do this. Dr. Dassani is the boss. Well, damn straight Dr. Dassani is the boss, right? Because the goal is to become a trusted part of a team that it's your village for this patient, and not just children, adults as well. Children for sure, but adults as well. And referrals aren't built with one lunch and learn. I have doctors come in and say, well, I took business cards and cookies and nobody refers any patients to me. You have to communicate. You have to show them that you're consistent. They have to build trust. Think about it. If I were, let's assume I am an endodontist, right? A specialist who is moved into your neighborhood, and I go to, since Dr. Sarah and Michelle are up here on my screen, I'm going to pick on them. I go to Michelle's office and I say, I am a specialist and I just moved into the area, and I use all the latest and the greatest materials, highly trained, have a lot of experience. I have a microscope, this, that, send me your patients. I'm sure you want to send me your patients, but do you not want to build trust with me first? Do you not want to know that I'm not going to be an ass to your patients? Do you not want to know that I'm kind to my team? Do you not want to know that I do excellent work? That I'm able to get your patients in case of emergency sooner rather than later. You're not going to make them wait. There's so many things we look for in our referring doctors. It's the exact same thing with this. So why do we think we can walk into a MD's office and say, I make sleep appliances, send me your patients? Okay. We need to give them the tools to understand why you're doing this. What is it that you're screening? What are you finding? What do you want me to do next? What are you going to do next? Let's communicate, right? And then the business systems, of course. If Airway is going to become and remain a part of your practice, it has to be sustainable. It cannot be a flare that goes up and poof. There has to be systems in place. How many patients are we screening? What gets measured gets improved, right? So in my practice or my team, at the end of the day, it's a non-negotiable. We run our practice KPIs to how much treatment was presented, how much treatment was accepted, new patients seen. Did we lose any patients? Did patients move away? Did they decide they hate Dr. Dassani and don't want to come back to see her anymore? Or did they just move to Florida and are going to go see one of the other amazing doctors we know? Same thing. How many patients were screened? This is just Airway, right? How many patients were screened? Conversations were had. Did we present cases? Was any treatment started? Maybe this patient we had a conversation with them 6 months ago and they're like, I'm finally ready. I'm ready for scans. My wife is tired of me snoring. Let's get this going. What was production, profitability, outcomes? Do you think that today's patients, you're the best thing that's ever happened to me other than my wife, is going to go in that? It is in air quotes. Because every time I have a case that doesn't go the way I like it, I'm going to pull that spreadsheet up and go like, oh yeah, that was the day. It was a good day. I still do good work, right? So you got to know what needs to be improved so you can actually work on improving it. This is part of your workbook. So hopefully you've been able to pull it up and kind of grade yourself on the questions there. I'm not going to take up time by pulling up the workbook here, although I could, and going through it. That's yours to look through as you go through the pages. Grade your practice. And I don't mean this in a negative way, but score yourself. Where do we need improvement? What do we need improvement? Or it's like, we're rocking this. Then go buy everybody breakfast tomorrow. Take Starbucks to the office if you're rocking it. But score yourself. Where is it that we're lacking? What area needs improvement? If you truly are serious about adding airway to your practice, you cannot treat it as a hobby. I'll be honest with you. You have the power, the capacity, the capability to change so many lives. It's not even funny. Airway becomes your team's legacy. It's not my legacy. In my practice, it is my team's legacy. The minute you start to treat this in your practice, your first patients are going to end up being your team members or their spouses or their family members. If you get into pediatric, they're kids. And when you can actually see how much of a difference it makes, like, the patient today, of course, but I know when I opened up this, I said, we've had personal loss. I've lost my brother to sleep apnea. And you think he didn't have all the appliances I could make him? Every new appliance was on that nightstand because he wouldn't wear it. And I was like, ooh, look, this one's skinnier. It's not as bulky. Maybe you like this. Oh, that one lets you move your jaw more. Oh, this one is a prettier color and a CPAP. When we grew up, my dad used to snore. He doesn't snore anymore. Needless to say, he's had a sleep study and everything. And it was the funniest thing. If you've ever had a loved one that snores and your kids, or if you hear kids talk about snoring, they're like, you're so funny. Daddy makes funny noises when he sleeps. Now I know he was stopping breathing or whatever that was happening. And my dad is 80. He'll be 81 in November. Knock on wood, right? So my brother never took it seriously. It was always like, Daddy's fine. You and your airway stuff, you're just so dramatic, right? Does anybody have a family member that's like that? We're just extra. And needless to say, he didn't wake up one morning. He has two little kids. And it's the guilt that you cannot get rid of. What more could I have done? And you will hear these stories with your patients as well. You will talk yourself blue in the face, and they will not listen. Patient in hygiene today came in with a Holter monitor. I was like, what's going on? Well, I have AFib. You hear AFib, you better talk to them, beat them on the head, not literally, with sleep apnea. Get your sleep study done. Let's see if you have sleep apnea. Well, this lady has been wearing her monitor, Holter monitor. She has to wear it for a month. She's in her last week. She was like, then I'm going to give it back to them. I said, do me a favor. Talk to your cardiologist about a sleep study. Well, what does that do? I said, it's going to tell us if you're stopping breathing, whether you're snoring, if your oxygen levels are dropping. That could be why your heart has to work the way it does. Oh no, I wear a Fitbit. She does. She's an older lady. She must be like 70, 67? No, 76. Me and my dyslexia today. So older. My Fitbit says I don't snore. Do me a favor, humor me. Just, tell your doctor, I see Dr. Dassani, and she is worried about my sleep. She thinks I need to ask you about a sleep study. Please ask your cardiologist this. Did not want to listen. All I can do is talk myself blue in the face. And all you can do is talk yourself blue in the face. Because it's just, all you need is one patient or one somebody that has a heart attack or stops breathing or whatever. I pray nobody ever stops breathing. But that's all it takes for us to go. And as type A as we all are, as much as we measure our success in millimeters, microns, it's a hard pill to swallow. Because, like I said, and it's not just my brother, I've had patients too that have had heart attacks, have had strokes, come back and say, I should have listened to you. You do this long enough, you'll hear every story. January will be 15 years for us. You hear of all the good and all the bad things. We've had 23-year-old young men come into the practice because they're getting engaged and they need help in the bedroom. Is a 23-year-old man coming to the dentist to help with sexual dysfunction? You know you are their last resort. How many young women, how many females, how many children are being missed because we're not having the conversation and they don't fit that mold? They don't fit the fat Uncle Joe mold that we think OSA patients fit. How many menopausal women have been told their fatigue, their tiredness, their brain fog is because it's menopause? It could be. I'm not denying that. But who's even asked her about her sleep? When you have moms, I had a hygienist. This was during COVID, not my hygienist. She drove 2 hours to bring me her 1 month old because he was stopping breathing. She slept in the crib with her hand over his chest so she could wake him up to start breathing again because she knew something bad was going to happen and nobody would take her seriously. When you hear and experience all of these stories, there's just no reason why we should not be talking about this. Coming back to why we're here today. Where is your biggest gap? I can promise you it's not what course you should take next. Although if you want a course recommendation, hit me up. If you don't want to take my course, there's other courses I'll recommend to you. All I care about is you getting trained. But if you have the knowledge, or if you're looking to get the knowledge, it really doesn't matter. I want you to consider, what system do I need to build? How can I make this predictable in my practice so that my patients go from start to finish and there's very few hiccups or they don't get lost along the way? I want you to be able to talk to a patient, talk to an MD, talk to each other, go to a dental conference, talk to your dental rep. By the way, my Patterson rep is also my patient, Airway patient. We made an appliance for his wife as well. When I say your family grows, I wasn't even kidding. I want you to be able to step up and say, not say I offer sleep appliances, but I have a system. I can predictably identify, evaluate, treat, follow, collaborate for my airway patients. I may not have all the answers. I certainly don't have all the answers, but I know somebody who does. And that means picking up my phone and texting my ENT or my sleep MD or the myofunctional therapist or another dentist or my orthodontist. Today we had two sisters, two young ladies come in to see us for a pediatric evaluation. I'm in Houston. They came in from Huntsville, which means the parents drove 2.5 hours each way to find a practice that would listen and would treat. And I had to send the older sister to an orthodontist that I trust and I work with. And we're going to be treating the younger sister in the practice. With the reassurance to the parents was like, you're going to be involved, right? In the older one's care. I was like, trust me, I would send my kids to this orthodontist, but you're going to be involved. You will keep track of what's happening, right? Yes, ma'am. I sure will, because I have a collaborative practice. I'm not just about me, me, myself. Although some days, yes, especially when it's with my husband. But otherwise, no. We got to do what's good for the patient. That is what makes you an integrated airway practice. So if you want to do one appliance a year, sure. If you want to do one appliance a month, sure. One appliance a week, that's more doable. I have practices within our mastermind that are in the process of transitioning. The doctors are transitioning to airway and aligners only. They're bringing on associates, they're expanding practices. We have one doctor that's going to 18 ops, and she is stepping away from restorative to go airway and aligners. The beauty of having an integrated airway practice is it gets to be what you want it to be. What is your dream? Me, I'm crazy. I like teeth. So I don't want to give up prepping teeth. I don't like surgery though. So I've given up extractions. I don't do endo. I don't do implants. If there's blood, I don't want to look at it. But I'll still prep. I'll still do my airway. We do aligners. I'm a general practice. We have kiddos come in. That's the beauty. You get to build it the way you want to. There's no right way. There is a wrong way, though, is when you actually talk to patients, get their hopes up, they actually start to feel heard, and then they get lost because somebody drops the ball somewhere because they don't know what to say or because we don't have a system in place. So I don't want it to become another thing on your plate. You still need to be screening. I mean, don't get me wrong. Whether you want it to be on your plate or no, ADA guideline, AAP, AAPD guidelines, whatever it is, you still got to be talking about it. What I want for you is for it to become part of your new patient exam. What does that conversation look like? In my practice, new patient exam is an hour and a half. No cleaning is promised. But you will leave with more info than you would have ever heard about your health, your teeth, your airway, whatever that may be. And it may be you are perfect. Don't change. All you need is a prophy. I'll see you back in 6 months. But it's not because we didn't do a thorough job. It needs to become part of your hygiene visits. If you are a hygienist that's here, I know we have a few that are registered. It should be something you're talking about. It should be something you're presenting to doctor when they walk in. What are the team conversations when there's a handoff from hygiene to front desk or hygiene to assistant? What is that handoff? What are those conversations looking like? And I don't mean teen conversations that's still like, did you see? She was so stinky. She didn't even floss her teeth. That's not the conversation. We're not gossiping or negative talking. Clinical workflow. Does doctor know when sleep study has been received from the MD? Is the patient ready to move ahead with treatment? Can I submit my prescription for the appliance to the lab? What's my referral network looking like? Does Dr. Maksud need to see the patient or does Dr. Tram need to see the patient? Who am I texting or calling because my patient today cannot breathe through their nose adequately? What's my business model? Do I want to be aligners and airway? Do I want to be general? Or we have one doctor who loves implants. So she hired her first associate last week. And all she's going to be doing is all on four cases, aligners and airway. That's her magic space. And that's all she's going to do. She gets to decide. And that's when we get to say, this is how I practice dentistry. I'm not apologetic. I don't do extractions. I don't do thirds. I don't do root canals. And I tell patients that this is how I practice dentistry. I don't want to do everything. Can I? Yes, I'm trained. Does it mean I should? No. And you really don't need to build this alone. I mean, here is my invitation to you guys. If this is something that you feel you're looking to build within your practice, if this is where you see your future, if I were to ask you, um, Michelle, where do you see yourself 5 years from now? And Michelle says, I really want to be seeing more airway patients. I really want to be doing this, this, this. This is my goal for myself, my life, my family, my clinical practice. If you want those roadmaps, the systems, if I say don't reinvent the wheel, I've done the mistakes, learn from my mistakes, get the template, the training. My office manager, Christina, she's not on the call today, but she is part of the program that we teach. She's been with me 15 years. She's my office manager, does all my dental billing, does my medical billing, is my adult sleep coordinator. So when somebody says, oh my gosh, four things, I need four new people, you don't. All you need is systems. Do I drive her crazy some days? Most days. But she drives me crazy too. That's that's where you have the team that does what needs to be done. When you are headed to the US Open tomorrow, right? That is my invitation. We are finally opening doors to the Integrated Airway Practice Institute for this year. I think I have details somewhere here. There we go. If this is something where you want to build that clinical operations team referral, all of those systems within your practice, structure it, integrate it, implement it. Details are on the website. Andres, if you would drop the website, please. You have the option, it is a 1 year program. You have the option to pay as you go per month, $649 per month, or you could pay, save some money and pay for the entire year upfront. Um, you get a community. We have monthly calls. We go over systems, protocols. You have access to every single course that I'm building that I have, adult sleep apnea, pediatric, medical billing, all of that. You have my team to support you. We also do case discussions. So if you have a case that you're struggling with, or you're like, I'm scared, it's my first case, Meghna, hold my hand. Right there, I will hold your hand, which is why you have access to me for a year. Doctors that have joined in the past have been with us for 4 or 5 years, counting. I have a doctor that's been part of the group for since I launched in 2017, and she's rocking sleep. I mean, what can you say? So that's my invitation. I don't do discount codes. I don't believe in upselling, overselling, all of the BS that happens. This is what it is. It's information. If this is right for you, I invite you to come join us. The only thing I will offer is for those that sign up by the end of today or maybe even tomorrow, I will include a 30-minute one-on-one session just for you and I. And we can get your practice dialed in to where it is that you need to start, just so there's a little bit more hand-holding and personal attention. But that's what we have. If anybody has questions, I'll take questions. Post it in the chat. We will also post, I know there's some that have other questions, not clinical, but about the program itself. If you want to schedule some time one-on-one to chat with me, we have a Calendly link as well. And I believe that is it. So yeah, stop collecting airway knowledge and start building your practice, please. Let's get to it.